Today I'm going to talk to you all about complete androgen sensitivity syndrome, or CIS. And later, Marley's going to talk to you all about a case study of 3 sisters who were told they had this. So CAIS is a disorder that occurs in 1 in 20,000 people, and it's when a developing embryo has problems with the androgen receptor gene, which is needed for male sexual development. This problem causes a female to not respond to testosterone and therefore not develop male body parts. And this makes a person have a female phenotype but with a male genotype, so like a 46XY. A person with this disorder has testes instead of ovaries, but they're undescended and can't produce any sperm. So it's basically a female with a male reproductive system that doesn't work. CAIS is usually first noticed when a girl does not get her period, or if no pubic hair is developing, and if they want, they can see a doctor for this. Women usually get hormone therapy treatments or have their testes removed. So this is what regular female genitalia looks like, and next it's going to show you CAIS.
Okay, let's talk about case number 1. Imagine going through your whole life thinking that you're a girl, acting like you're a girl, and then going to doctors and they tell you that you're genetically a boy. This is what happened to these 3 sisters. In case 1, a 19-year-old girl went to her gynecologist complaining about the loss of primary amenorrhea, which is basically the absence of her period. So this obviously raised some concern, but she looked like a regular teenage girl. But further examination revealed that she did not have ovaries or a uterus. So she went to endocrinology, which is a doctor that specializes in hormone-related diseases, and they took a cytogenetic analysis of her blood, which revealed that she had a 46XY karyotype and testes instead of ovaries. So she was female on the outside but male on the inside. But the testosterone in her body was aromatized into estrogen. Anyway, she went and got an orchiectomy on both sides of her testes and hormone therapy throughout her lifetime. Unfortunately, she was still infertile even though they removed her testes. Alright, now let's move on to case number 2, which is patient 1's older sister. A 22-year-old woman with symptoms similar to her sister went to the gynecologist complaining of the same thing. Now, she was a fully feminine, developed human being. Neither she nor her husband knew there was something wrong with her until her sister had gotten checked out, and she also had the absence of her period, so that raised some concerns. But she went to the doctor and got a karyotype test, which revealed that she had a 46XY, and her testosterone levels were much higher than the average female. She ended up getting an orchiectomy as well, but she was discharged from the hospital a day earlier than her sister. Alright, now let's talk about case number 3, which is also sister number 3. This, I think, is the most interesting case. She was 27 and married without any children, and this time the younger siblings' doctor had called her to get rechecked out after knowing about the younger siblings' disorders. So she actually already had problems with DSD, which are conditions involving hormones and reproductive organs. She brought her old discharge reports to the doctor, which showed that she had gotten hernia repairment surgery, inguinal masses removed, as well as an orchiectomy. She also had a 46XY karyotype. She did not tell her sisters anything, about her previous surgeries. Nobody knew her diagnosis. She didn't want to tell anybody, and she also refused physical re-examination. Okay, now we are going to talk about the aftermath of this disorder and what people struggle with. These 3 patients refused photo evidence due to their religion, but many patients find it very insulting to take pictures just because it is not deemed as normal. But actually more people struggle with this than you think. CAIS is also a type of DSD, and most sexual disorders are referred to as DSD because other names are humiliating, like hermaphroditism, intersex, sex reversal. Those are all deemed as humiliating towards these people that struggle with this disorder. CIS is not to be taken lightly, and many people find it embarrassing to go to therapy for it and to talk about it. Such as sister number 3, she did not want to tell anyone that she had this disorder, not even her own siblings. If you ever find yourself around someone with this disorder, be as respectful as possible, and in general, if you're talking about it in a group, just be respectful.